assessment if that's okay.
Okay, that's fine.
Could I get your first and last name and your date of birth?
Marilyn Aranda, and my date of birth is 2/21/2001.
Looks good. And then do you know where you are?
Yeah, I'm at St. Agnes Hospital.
And do you know why you're here?
Yeah, I'm just having some pain on my wrist.
Some pain on your wrist.
Mm-hmm.
And then do you know what year it is?
Yes, it's 2024.
Okay, and then about this pain on your wrist, how long has that been happening?
It's been roughly like 3 months.
3 months?
Mm-hmm.
Is there anything that helps your pain? Are you taking any medications? Anything making it worse?
I'm not on any medications. It's okay. It gets worse whenever I use it a lot, and then when I don't use it that much, it feels better. It's like I don't know, maybe like a dull pain.
A dull pain?
Mm-hmm.
And then how would you rate it on a scale of 0 to 10 for the intensity?
So when I use it more, it's probably like a 8, and then when I don't use it that much, it's probably like a 3.
How much would you say it's affecting your daily activities?
Probably like a 5. Like when I don't use it that much, it's okay, but then when I have to do things around the house, it gets worse.
So what could be an acceptable level for you to keep doing your daily activities around the house?
Maybe like a 3.
A 3? Okay, we'll work on getting that there. But for right now, I'm just going to take a quick listen to your heart. We looked at the vital signs from 30 minutes ago. The blood pressure, respiratory rate, temperature, you're all in range, so nothing is a big red flag yet. I'm just going to listen for the rate, rhythm, and then your sounds. So you have clear S1, S2 sounds, that's good, a nice strong and regular rhythm. And then I'm going to take a listen to your lungs. If you can take some deep breaths for me.
Okay.
Deep breath.
I did a bunch of that, I feel like it's hard.
Another one. Another one. Another one. Another one. And then if you can sit up for me, I'm going to listen in the back. Some more deep breaths. Another one. Another one. Are you having any shortness of breath?
A little bit after all of this.
It's okay, take your time.
You nurses have to listen to a lot of breaths here.
I know, I was mostly looking for any adventitious sounds, like crackles or something like that, but your breath sounds are good, sounding vesicular breath sounds, which are normal, and the depth is nice and deep, so that's good. And then if I could get your grips on my fingers, just squeeze these, and then push my hands. That's looking good. And I'm going to check your pupils, so there's going to be a light coming in from the side. Just keep looking forward. And then follow my pen with your eyes.
Whoa.
So your pupils are equal, round, and reactive to my light, and they're accommodating, so that's all good. And then I'm just going to assess your skin and a little bit range of motion. And I was kind of looking back here earlier, and it was looking good. I'm going to look for any JVD, which is a sign of heart failure, but you're good. And
Why are you cold?
I know. Just gonna see if your lymph nodes are swollen. I'm gonna take a look inside your mouth if you can say ah. That's good. And then do you have a history of any heart disease or any complications like pacemakers, surgeries I should know about?
Not really, not that I know of. Sometimes they say that like my refills are bad.
Your refills are bad. They were singing normal. Let me double check. Less than 2 seconds.
Okay, good. I was a little concerned about that, but I'm too young for all that stuff.
Yeah, sometimes when you're cold, it can slow it down a little bit.
Oh
but
yeah, I always get cold.
It's good. And then I'm going to take a listen to your bowels, and I'm going to inspect them as well. So,
Listen, you don't want me to go to the restroom?
no, I'm just going
Oh, okay.
You stay here, and I'm just going to lower this a little bit.
Okay.
When was your last bowel movement?
Yesterday, I believe.
Yesterday?
Mm-hmm.
And was that a normal consistency? Did you have any constipation, diarrhea?
Yeah, no, it was like normal. I'd say like forms and brown. I would say like at least once a day.
Okay. And how has your appetite been in the hospital? Are you finishing your meals?
Yeah, I would say it's good. I eat like 3 meals a day, and sometimes I'll snack, and I finish my food.
Okay, that's good. So I am looking for any lesions, any obvious distension, bruising, tattoos, things like that. And so far it's looking good. And now I'm just going to take a listen for hypo, hyperactive, or just, normal active sounds. Starting in the right lower quadrant. A little hypoactive, but we should be getting lunch soon, so
Okay.
then we'll get you.
I'm pretty thirsty too.
Okay, I'm gonna palpate. Let me know if you feel any pain. And I'm just checking for additional distension, masses, things like that.
Okay.
I'm gonna go a little lower and palpate your bladder for fullness.
Yeah, I have to pee.
You have to be all be light on that.
Thank you.
I can feel it's a little full. And then, how has your urination habits been? Normal for you?
I'm a little bit dehydrated, I would say, but other than that, they're okay.
So has that been a little more yellow urine?
A little bit more yellow, yeah, not more frequent or anything, no.
Okay, and is there any pain, burning?
No.
Have you noticed any pain with sex? And have you had a regular menstrual cycle, things like that?
No, everything's normal.
Everything's normal?
Mm-hmm.
Sounds good. I'm just gonna go in for your pulses. Checking to make sure they're equal bilaterally with strength and rhythm. And they are, so that's good. And then I'm going to go down. Make sure your range of motion is good. Let me know if there's any pain with any of these movements. Here. And the pedal pulses. Give it like a +1 on the strength. And then can you push down like a gas pedal and pull them back? Looks good. Okay. Alrighty. And then as far as edema goes, you're looking good. I don't feel any edema around your legs or your arms, so that's all good. And
I completely forgot to tell you that I am on iron. Sorry.
you are on iron.
Yeah, and then they just want me to drink more water, so I didn't say like that. I'm dehydrated.
Have your bowel movements been dark in color because of the iron?
No.
Okay, that might happen as a side effect, but if it does, still let us know because
Okay.
it's important.
Okay.
And then I'm just going to check your ears,
Okay.
which are good. There's no pressure injuries or anything like that.
Okay.
And your skin turgor is good. So you're not too
Oh, okay,
dehydrated
good,
as far
yeah.
as that goes.
That's why I was worried, because they always say I don't drink enough water.
I'll get you some water right now with
Thank you.
lunch, and then yeah,
Okay,
that's all
thank
for
you.
now. But just let me know if you need anything else.